Good afternoon, everyone. Today we are going to speak about how we are going to plan for setting up of an ART lab, that is IVF lab. So IVF lab is very essential prerequisite for any level 2 ART clinic because we are mimicking the mother's womb. Like in the same way, we are maintaining the IVF lab parameters to have successful pregnancies. Okay, but mainly when we are actually planning for an IVF lab, we have to follow certain laws and regulations by Government of India according to the recent act which is launched in 2021, that is ART Regulation Act on 20th December 2021. According to this act, we have to know who are the people who can form an ART lab and how we are going to approach the government for planning for an ART lab. So there are certain authorities that regulate the ART. First, that is National ART and Surrogacy Board and the State ART and Surrogacy Board. In Andhra Pradesh or Telangana, we have to approach the state authority boards before applying for an IVF clinic. And the National ART and Surrogacy Registry and appropriate ART and surrogacy authorities will be there. For example, if you're planning to go for a donor thing, we have to approach the National Registry also before planning for the treatment. Registration process, an application we have to forward for the ART clinics to appropriate authority, and the registration validity is about for a period of 5 years. Every application for registration shall be accompanied by an application fee of 50,000 for level 1 registration and 2 lakhs if it is for a level 2 registration. And level 1 registration, we will do only IUI is done. We won't be able to do any other procedures like IVF or ICSI. In level 2, surgical retrieval of gametes, handling oocytes outside the body, IVF, ET, and cryopreservation of gametes can be done. For a level 1 ART clinic, the mandatory staff is minimum we have to have 1 gynecologist. The qualification shall be a medical postgraduate in gynecology and obstetric. We require very minimal equipments like microscopy and 1 centrifuge and 1 refrigerator. But when it comes to a level 2 clinic, we require an andrologist, embryologist, counselor, anesthetist, and a medical director to have a level 2 registration. So we in any IVF clinic, whether it is a level 1 or level 2, we have to remember the age of the mother, woman and the man. For women, it is 21 to 50 years, and if it is a man, 21 to 55 years. Other than these criteria, we are not supposed to do even IUI procedure, even if it is an azoospermic man, or even if it is a decreased ovarian patient, we can't do any procedures on that particular age groups. So record maintenance is very important when we are planning. We have to keep it in our mind before planning for an IVF center. Records should be maintained for 10 years and related to the enrollment of couple, women, gamete donors, procedure undertaken, outcomes, complication, if any, has to be maintained. Okay. Records to be uploaded to the National Registry online within 1 month, but as of now, National Registry is not available. In case the clinic stops functioning within 10 years, the records must be transferred to the central database, that is a National Registry. So essential pillars of IVF lab is mainly the infrastructure is most important. Coming further, it comes to equipment and then comes to the staff. So important is beginning is half done. Like if you are having an IVF lab which is functioning properly and we are setting up in proper way, half of the work is done as a doctor. So coming to ART laboratory setup, we have to focus on 3 things. First, we have to see which place is good for setting up an IVF clinic and how we are designing it, what equipment we need to buy, what consumables we are thinking about, and paints and adhesives. And staff recruitment is also very important. Procedures like standard operation SOPs should be there. Quality control and double witnessing system has to be followed in any IVF center. Ideal place is first floor is ideal because of less disturbance. Avoid basements. Check for any damp areas or water seepage. Connectivity of lifts or elevators is very important because once we are forming a lab, we have to store the embryos, for which we have to require nitric oxide cans. The transportation of gas cylinders and nitric oxide is very important. If we are establishing an IVF clinic in hospitals, we have to make sure we are actually away from radiation sources like X-rays, where radiation therapy is done. We have to make sure we are away from those particular places. Area required for ideal lab is 12 into 12 square feet. OT, it is again 12 into 12 square feet. Andrology, 10 into 6 square feet is enough. This is actually shape of an embryology lab and the system. Embryology lab and OT should be interconnected. with the help interconnected, and scrub area should be there, and freezing room should also be near the embryology lab. We have to have separate rooms for freezing, semen collection room, andrology room, and doctor's room. It should be separate. Even carbon dioxide cylinders room should be separate, and we have to make sure carbon dioxides are adequately filled for the ART lab. Action plan is very, very important from start to finish. We have to survey everything before, including the budget, how we are going to get equipment and environment engineering. We have to plan accordingly. What is the infrastructure? Coming to the infrastructure, embryology lab, we are mimicking in vivo atmosphere, which is very extremely important for optimizing the fertilization, cleavage. Most of the time, they're always an incubator. So controlled temperature, carbon dioxide, humidity should be maintained in the ART lab. Culture media should be controlled temperature. If we have to save it in separate refrigerator, which should be attached to the ART lab. Gametes and embryos are always taken outside for different procedures, like to see, to do ICSI, to check the fertilization, to grow the growth pattern. And sometimes we do different media also. For changing media also, we require to take the embryos outside. So all these procedures should be done in embryology lab. So because of which we have to do quality check like temperature, humidity, air control every day in the embryology lab, which will check for VOCs and microbes also. So ambient atmosphere of lab extremely important for maintaining the fertilization rate and pregnancy rates. The air quality plays a significant role in embryogenesis, implantation, and conception in the ART cycles. So what kind of problems we are anticipating is there is possibility of VOCs. VOCs are nothing but benzene, aldehyde, and alcohol particles. It is routinely used in our daily basis, like it is present in nail polishes, it is present in paints and hairsprays, perfumes. So, as a gynecologist or as an embryologist, we should stick to certain regulations. We should not use perfumes or nail polish, and we have to communicate same thing to the patient as well as to our embryologist. And even the fabric cleaners also, instead of that, we have to use oocytes for cleaning the lab and OT theater also. We should not use any fumigation. We should not use any peroxide and all for cleaning the ART labs. So maintain the air quality means we have to maintain heating, ventilation, and air conditioning system has to be in place for optimum environment, which is necessary for the fertilization and embryo development. What is the role of HVAC is it delivers the clean air to the room, removes contaminants, and pressure. It maintains the pressure in the room and control temperature and the humidity. iOS 7 is the standard of IVF lab and clean room standard which we are supposed to maintain, and the particles should be class 10,000, which is very important for a good ART lab. This is how the air quality unit is handled. You can see the number 1, outside air is entering into the system. It is going into flow chambers like 2, 3, 4, and 5. Here there are many systems where hindering the VOCs to enter into the ART lab. So once the outside air handling unit equipped with dust and potassium permanganate, it is also impregnated with carbon activated filters. So when the air is flowing into all these filters, there is decreased risk of VOCs entering. But a HEPA filter is like air diffuser. Most of the abnormal particles is filtered by HEPA filter. But what is the disadvantages of HEPA filter and VOC is, you can see down, but HEPA pore is very big. When it comes to VOC pore, so VOC molecules are very, very small. HEPA pore is around 0.34 mm. So VOCs easily enter into the labs even with the presence of HEPA filter. So importance of maintaining air quality is increasing the clinical pregnancy rates and decreasing the miscarriage rates according to different standards. There are certain consensus like Cairo consensus and Estre consensus where the regulators how to maintain the ART lab. Air quality particles should be less than 352,000 particles, and microorganisms should be less than 10 cubic millimeters, and VOC should be 4,000 to 8,000 particulate per billion total VOCs. Air change. Air change means air exchange keeps happening from outside air to inside air. 15 total air changes per hour is advised, including 3 fresh air changes per hour. When it comes to overpressure, recommended pressure is about 30 pascals. Temperature should be between 20 to 24 degrees centigrade. Humidity should be maintained between 40 to 45%. Coming to infrastructure, water-based paint should be used. Silicone materials as sealants, avoiding aldehydes to enter into the lab. Laboratory walls and ceiling, minimum penetration. Sealed lighting should be there. Steel or powder-coated aluminum furniture. Steps for vermin proofing is also important. Strictly sterile and non-sterile zones should be maintained by doctors and the embryologists. So whenever we are starting an IVF lab, there is a mechanism called burn-in. What is this mechanism is? Increase the temperature of the lab by 10 to 15 degrees centigrade. So by increasing the lab temperature by 10 to 15 degrees centigrade, air cycles, the increasing lab temperature, it should be done 2 to 3 weeks before starting the lab. So by increasing the temperature, we are going to decrease the bacteria entering into the lab, and we are going to change the air system inside the lab. So this is the minimum equipments which should be maintained in an ART clinic. Microscope, incubator, laminar flow, sperm counting like macula device, centrifuge, refrigerator, equipment for cryopreservation, oocyte aspiration pump, ultrasound, test tube warmer, and anesthesia resistation trolley should be there. You can see two types of incubator. One is the box incubator, other one is trigas incubator. In trigas incubator, there are different types of trigas incubators. In this trigas incubator, you can at a time freeze or grow the embryos of 10 patients. This is how a total IVF lab is going to look. This is the laminar flow with a microscope, compound microscope, and this is a HEPA filter. This is box incubator, and this is the microscope, inverted microscope in which ICSI is done. Quality management, appropriate steps need to be taken for the correct identification of gametes and embryos to avoid mix-up, which is very, very important. Most of the times, patients will be asking us this question: how we avoid a mix-up, and what care we should take during this. Pipettes used should be disposed of immediately after use. We should not reuse any pipettes. Laminar flow hoods, laboratory tables, incubators, and other areas where sterility is required must be periodically checked for microbial contamination using standard techniques like we take swabs weekly twice to identify any bacterial contamination. A logbook must be maintained which records the temperature, carbon dioxide, humidity of the incubators, and the manometer reading of a laminar airflow. All instruments must be calibrated periodically, and record of such is maintained inside the lab. So this is how we avoid the mismatch. There's something called as giving a unique identification number to the patient for a particular couple of patients. So what we do in the system is, whichever sample we are receiving from the patients, we actually, that identification number is tagged to the patient. So in case, if other patient oocytes or sperm is coming into the RA witness system, then definitely the RA witness system will show mismatch immediately. This is an example. So if we start a cycle, we are naming it as A and A for particular couple. So when we are treating this couple, only A and A can match. If you are bringing B, like sperm of other patients, immediately the system will tell mismatch. So RA witness system in place is very, very important to avoid any mismatches. Okay. Quality of consumables used in the laboratory is very, very important. All disposables of plasticware must be procured from reliable sources. Means any reliable sources which ensure that they're not toxic to the embryos. When we are actually starting our IVF lab, we have to test for sperm survival assay to identify how our gametes are going to survive in our lab. In the same way, we should test our culture media, which is used for processing sperm, gametes, and growing embryos. And we have to check each batch osmolarity, endotoxins, and pH. We have to should know the composition of media that is being used. Most media are supplemented with serum. They should therefore be tested for antibodies to HIV, hepatitis B, and hepatitis C RNAs. So important staff in ART cleaning is gynecologist, andrologist, embryologist, counselor, anesthetist, and a medical director. The project doesn't end, it rather begins after completing a ART lab. The success mainly depends upon the teamwork, mainly competency of the team, training of the staff, quality control, quality assurance. Proper SOP should be there. Record keeping and timely audits are very important. Patient-centered individualized approach is very important for better success rate. This is our IVF lab. This is the recovery room after the procedure. This is the box incubator where we are preserving our gametes, and this is the triple gas incubator, inverted microscope. This is the laminar flow with compound microscope. This is the pass box where the gametes like oocytes, once we do pick up, it will be going from OT theater to the into the embryology lab. Thank you. Anyone moderating the session? Any questions? Thank you, everyone.